Now, there are 2 new cases of COVID-19 to report from managed isolation facilities in New Zealand today. The first case is a man in his 20s who arrived in New Zealand on 19 June. He flew in from India on Air India 316. He has been staying in managed isolation at the Pullman Hotel, and now, as is our protocol, being moved to the quarantine, which is the Jet Park Hotel. The second case is a man also in his 20s who arrived in New Zealand on the 18th of June from the US of A. He was on flight NZ5 from Los Angeles. Man tested positive at the Jet Park Hotel after showing respiratory symptoms. Now, he had been at the Jet Park Hotel from his arrival. I understand there was a mix-up at the airport and he got in the wrong group, so he ended up going to the Jet Park. So he's actually been at the Jet Park since arriving, became symptomatic and was tested as a result. So actually, both of these cases were picked up at our now routine testing at around day 3. In the second case, as you'll note, the man was also symptomatic. I can also say that one of the cases who has been in isolation in the Wellington region, in the Hutt Valley, is now considered recovered, and recovered being at least 10 days since onset of symptoms, at least 48 hours asymptomatic, and a negative test. So the total number of active cases in New Zealand is 10. Our total number of confirmed cases now is 1,165, and we still have the one significant cluster open. This is the one in Auckland at St Margaret's, but obviously no cases as a result of that cluster for some weeks now. Yesterday there were 4,303 tests processed at our laboratories around the country, and our total completed to date is 348,822. Just some comments on our testing as part of our border measures. So since June the 9th, we have rolled out the testing and managed isolation facilities at around day 3 and around day 12 of people's stay. There's been some suggestions in recent days that we should be testing people on arrival at the border, possibly as a third test. What we do at the border when people arrive, everybody arrives, is a health screen, a series of careful questions that they respond to. And anyone symptomatic at that point goes straight to the Jet Park facility and is managed as a symptomatic person and tested as part of that management. Anyone who is not reporting symptoms goes to one of the other managed isolation facilities. The reason we don't test on arrival and we wait till day 3 of the managed isolation is because that is about day 5 of many people's journey from wherever they have come from into New Zealand. And we know that testing then is more likely to pick up infection than earlier testing when people may be incubating the virus but not test positive. So that's the reason for the testing around day 3 instead of at the border. And likewise, the testing at day 12 provides extra security. First of all, because the tests do have a false negative rate of somewhere around 20 to 30%, but also it's part of our departure planning for people to make sure they do have, we can confirm that they don't have the virus. Now, I've talked before about the fact that these people who get positive tests quite late in the illness, there have been studies done in both Singapore and South Korea of these people who get a positive test. So the virus is detectable, but it's seems very clear from those 2 studies that they're not actually infectious. The testing, though, if it is positive at day 12, means that people's visit is prolonged until we can be certain that they are recovered. Okay, a follow-up on the context that we have been, or the follow-up of people following the 2 cases last week that came in on Tuesday, that were identified on Tuesday. So there are 3 groups of people. First of all, the 55 who had left managed isolation on a compassionate exemption between the 9th and 16th of June. And they either went to self-isolate under very strict criteria in the community, or they were on day leave to go and make visits, for example, to hospice or hospital. And as of yesterday, we had one person who hadn't been located. That person was located yesterday afternoon, and testing's been arranged there. The next group we followed up, of course, was anyone who had interaction through the Novotel. There were all the people who were there. They've all been tested. There were staff as well who were working there. And there were then people who had been at the hotel, the Novotel, between the 6th of June and the 13th of June, when the two women from the UK travelled down to Wellington. Yesterday, we had 11 people that were outstanding of that 190. And of those, 5 have now been further contacted and referred for testing. 3 have a community worker visiting this morning, and there are 3 where we're still working to contact those people, and we're using our finding services to ensure that we can make contact with them. And in terms of the staff at the hotel, of the 11 that were outstanding yesterday, there's only 2 that remain outstanding, and the hotel is following up with those. They will be tested as well. Then the next group, which was our really trying to cast the net wide, is to follow up everyone who left managed isolation from other facilities between the 9th and 16th. So as of last night, we had identified there were 2,159 people in that category. I should say that does include the people who had exemptions and the people who were at the Novotel for some of that period. As you will recognise, the dates don't quite match. The Novotel was the 6th to the 13th. So that figure of 2,159 is we've got from Healthline, because they're all the people who they were doing call-in checks to check on their welfare 3 times during their visit. Now those calls are in addition to the daily health checks by the nurses. That's more about welfare, planning for when they leave, making sure they've got accommodation and support. All those people, the ones that I haven't talked about already, have of course completed their 14 days isolation, which has been and remains the most important part of the border safety. They all received health screening on departure, and testing was offered. So work is ongoing to make contact with all of the people in this group. In terms of getting in contact with them, they get a text, they get a call. There are 4 follow-up calls, and if we don't get a hold of them, then we use our finding services, which includes customs and police, to get an address from their database. And then if necessary, like we did with the person yesterday, we'll send either a health provider around, one of our local health providers, and or we can use the police if necessary to locate them. So work is ongoing with that group. And just to reiterate, these are all people who have spent the 14 days in self-isolation, in managed isolation, and we are just following up as a final precaution with them all. All of those people will have received contact, or there will have been attempts to contact them. Sometimes the phone numbers are phone numbers offshore, so they're international cell phones, and the calls don't go through. But if anybody in that group hasn't yet been contacted, then I'm asking them, as I did yesterday, there's a dedicated number with a dedicated Healthline team, 09 302 0408. And as you'll recall, prior to the 9th, when we started to introduce the double testing, everybody had completed 14 days and then gone out into the community, and that remains the mainstay of our efforts to prevent importation of cases into the country. And I guess I'd just like two more comments to finish. New Zealand is one of a very small number of countries that not only includes the 14 days mandatory isolation, managed isolation, but also the double testing before people are allowed to go out into the community. This is, first of all, consistent with international evidence about that 14-day period, and that once people have completed the 14 days, they pose a very low risk to the community. Even if they might still have virus detectable, it does not mean they're infectious. And often the comparison is made, for example, with the jurisdiction of Taiwan, which has got a very good process for people coming in. But I should say that is not a managed isolation process. That is people self-isolating at home with community follow-up, very good, strict follow-up. So we're, as I say, one of very few countries that do that. And finally, a question that has been outstanding for the last few updates, a homeless person who apparently spent some time in managed isolation in Auckland. As far as we can tell, this is cannot be verified and may well be an urban myth. Sorry to disappoint you there. But thank you very much. But if anyone has information on that person, I'd be very happy to take it as well. Please.
2,159 people who left managed isolation. How many of them left without being tested?
I still can't tell you that number. And
why not?
This is because the testing was done and no NHI was necessary on the information the hotel has got. So we're busy matching the testing in the laboratory database with the names and dates of birth of the people that we now have from that research.
It was a week ago, though. Isn't that pretty poor that you can't give us that?
Yeah, I wish I could, but what I can say is, of course, that they'd all completed the 14 days. We had started to introduce the testing. We do know that many of them were tested on departure. Many we have followed up because they were in the Novotel or had been on that compassionate exemption. And we are wanting to follow them well up and do that match across. And yes, I would like to be able to have that number with you, but the matching work is ongoing.
All of those 55.
The 55 who were granted compassionate leave, were they tested before they were?
Some were tested before they went out and some were not, but we have subsequently followed them up. Now, just in that group, what I can say is yesterday I said there were 4 who hadn't been tested. That was 4 children. There are several others, 3 who weren't tested because of the circumstances, which were medical circumstances. Either they were going to get medical treatment and then it would have been a clinical decision to do it, or in fact they were palliative and going home. And then there are several who, once they
the Samsung quick drive washing machine can select the best cycle for each
their circumstances
load, including
changed,
from
so
your
they
phone.
decided to
It
actually
can do
leave
a
the
quick,
country,
powerful
so they weren't
clean in under
necessarily
40
tested
minutes,
before they
and
left
it's
again.
energy friendly. Plus, you can add in those forgotten items afterwards. Find out more at samsung.com.
They're allowed to mingle with other people who potentially have COVID because we didn't identify.
There are 2 new cases of COVID-19 to report in managed isolation facilities in New Zealand. They pose a very, very low risk to the community because A, they've completed the 14 days, and B, they are in managed isolation. And I know there have been a lot of stories about so-called mixing and mingling, which sounds like it's a wedding reception or a cocktail party. That is not the circumstances in these facilities. And you also know that, just to be sure of that, Air Commodore Webb has done an audit of the facility, so we're continuing to strengthen that. And again, we have had cases come in before when all we had was the 14 days, the 35 cases diagnosed since the 9th of April, and we have not seen any cases go out into the community. The 14 days is actually very, very, it's got room at the end over and above when 99% of people, if they're going to be show the infection, will have done that by day 11 or 12. So there's already room built into that. Sorry, just one follow-up question. Twice. The second case we are reporting today is a man in his 30s who arrived in New Zealand from India on 15th of June, and he's been staying at the Grand Millennium. So I don't think it was because we weren't testing enough, because you will recall through that period of in particular level 3 and into level 2, there was very wide testing happening around the country. And if there had been any infections leaving those managed isolation facilities, we would have picked them up there, but we did not pick them up. So we're confident that not only was the 14 days being the mainstay, but also that we didn't pick up any infection out in the community. So saying, we're now doing the double testing, and it may well be that in addition to the 35 infections that we did detect during that period because people became symptomatic, there may have been some people who were infected and asymptomatic, but the 14 days served its purpose, and that it will continue to.
We were celebrating zeros when there may have been cases that we weren't identifying.
We were celebrating zeros because we were very confident there was no infection out in our community, whether from people who had come through managed isolation or from people who had been infected through community transmission.
You said that the 2,000 odd that we've managed isolation since 9th of June were offered testing. Wasn't at least day 12 testing mandatory by that point? Why was it only offer?
Yes, so it is mandatory now, and it's in the new order. And under the old order, there was interpretation.
The law passed was very clear on the statute books. Mandatory testing.
Yes, well, the new order says that.
But the law that was passed by Parliament and the health response made it very clear that testing was mandatory and could be enforced.
So the testing at the border and all the quarantine arrangements sit under a health order that's under the Health Act that went into force on the 9th of April, which is from myself as Director General of Health and as National Medical Officer of Health. In there, it does not mention, it's not specific about testing. It talks about low risk and high risk. And that was the point that I clarified last Tuesday, that people could not be categorised as low risk unless they had also returned a negative test in addition to completing the 14 days.
So these have been since.
Now, staying across the ditch, international arrivals there are subject to a more severe form of quarantine than here. Tom Crampton, a New Zealander who lives in Melbourne, has had the dubious pleasure of being required to
isolate
this is the
in
point
both
I
countries,
addressed last week, but actually
there was clearly the
at
implementation.
home. When I spoke to him last night, I asked him
in the communication
how
there.
that came to be.
That's what I clarified last week, and so everyone who has left since the 16th will have needed to return a negative test,
to Australia,
and
they had to isolate.
that's made clear in the new order.
I got to my 8th day
which
in
came into
isolation.
effect
By that stage,
yesterday,
that's when it was really starting to turn up
the
around the world and getting a bit
testing at
hectic,
day
and I
around day
decided to
3
pull
and
the
around day
pin
12 is a
with my
requirement
work and
of
go on
managed
unpaid leave
isolation.
and return to New Zealand to work on my family farm while the world was going crazy. And that meant I had to do 2 weeks self-isolation in New Zealand at my home. I got in the day before level 4 started, and then
Yes, that was what I made clear. As soon as I found
2.5 months
about
at home
the 2
working, and
cases on the
just decided to
16th,
return back to Melbourne
within
to my
a
proper
very short
job.
period of time, within the
And
hour,
so,
a message
yes,
went
now
out to all the
I'm isolating for the
facilities,
third
and I could check
time
with my chief
in,
legal advisor
hotel
that
isolation
I
this time.
could,
So,
in my
a long
opinion,
road,
someone
but
was not deemed to be
anyway,
low
it is
risk
what it is.
unless they had
Indeed.
returned a
So
negative
what is
test,
the
as well
experience
as-
like in the
as well
hotels
as
in
the
terms
health
of
check.
social
Some of them were not
distancing,
tested,
the
that's right,
rules,
and
that
that's
sort of
why,
thing?
as an extra
It's
precaution,
been very
on top of the
strict so
14
far. I
days,
am
we're
with
doing the
my
follow-up
girlfriend
phone
and
call,
our
and if
mates,
they
so
hadn't been
there's
tested,
3 of us
we'll
in our
ask
own
them
little
to be tested.
bubble. We have 2 bedrooms there with a conjoining room. I can't really compare it to my time in New Zealand doing
I'm sorry.
isolation
It's
because
just
I was
the
just in my
teams are
family
working
home.
all the time.
But
and the numbers
here
are
at the
changing all
hotel,
the time,
it is
but
very strict. We're
I
not
would
allowed
like to have
leave
that number,
for
and
any
it was
sort of
asked of
reason
me, but it's
at
about
all,
being
and
able to
everything's
match
just
with the
brought to our
NHI
door,
number,
dropped
the
off,
laboratory data,
yeah,
with
and the whole process of getting from the
non-NHI
airport to the
data that
hotel
is
as well
collected
was all
at the facility.
social
So,
distance, and everyone was very strict about that.
Are you subject to 2 tests, and are they mandatory?
Yeah, we have tests on day 3, which we've done, and then day 11's our second test. Yeah, and that's
when they
you've got no
departed the
choice in
facility,
that.
before they
And in the
departed, I
days
don't.
before that
And again,
test, you were
the
just
key
sent to
point
your
here is
room
some
and
of
you
them
waited for that
were,
test?
it was day
The whole experience getting to the room
leave,
quite
and there were
long,
very
you know,
strict
at the
requirements,
airport
PPE
first,
use and so
you've
on.
got Australia
And then
sort of
they're
has
back,
to
so they've been
accept
tested.
you in,
They
and
were
then getting to the
subsequently
airport, you
tested in the
sign all these
facility as part of the
documents and
testing.
have a
And
detention
likewise,
notice against us in
others
case
who've
we
gone
try
out
to
into
get
the
out. And
community
then
have been
once
followed
you
up
get to your room, you
and
get allocated
tested.
a room, and then that's just it for sort of 2 weeks. You just get your food delivered.
Yeah.
You can order,
Look,
your own food.
I wish it was
if you
easier.
want, like Uber Eats and stuff like that. But
this
other
is
than
one
that,
of
you're
the
just kind of
one
left
of the
here, and they call
key
you every day.
challenges
to check
for
up
the
on you and
healthcare
see how
system
you're
is
doing,
being
and
able to link
the
up. We do
nurses
have
can
the
come around
NHI.
and
Once we
stuff,
have the
but
NHI,
other than
we
that,
can
you're
link
just sort of
data
left to
from
your
a
own
whole
devices
range
in
of
here
different
unless
sources,
you
and that's a
sort
real
of
asset to us.
mention anything.
Is there any
And in
exercise
this
allowed
case,
outside?
No, we've been
the
told
information
that,
collected in the hotels for
we
managed
only get
isolation
one
purposes didn't include the
15-minute walk
NHI. Of course,
for 7 days,
Now,
so we haven't had ours yet,
we've
but
got
we've
the
been told
routine
it's the next
testing.
day or
We can
two, so we're
collect that
looking forward
NHI
to
as soon as
that.
that
But
testing
no,
starts.
we don't have a
As soon as
balcony
people
or
get that
anything
first test, and
either.
then we're able
It's
to
just
match up the results.
just our bedroom, and that's it.
Are they charging you for the cost of this mandatory isolation?
No, nothing's charged to us, but sort of luxury items. If you just did want to, get your own food.
Some of them
like
indeed
Uber
were
Eats, you have to
tested.
pay
What I
for
can
that.
say also is,
Or
and
if
you'll
you
have seen
wanted
the
to get
expectations
alcohol,
and
you have to
requirements
pay
around
for.
people
You can get
going on
care
compassionate
packages sent
leave.
in from
There's
friends
a
and
very
family or
strict set
whatever,
of
but which you have to
obligations
pay
and
for that as
criteria
well, or
on
they
to
pay
ensure
for
that
that.
the community is
You
kept
could
safe.
do this whole process.
They're going in,
without
and the
spending
reason
cents if
they're
you
called
wanted to.
compassionate
And the
grounds is because
cases
they're
in
going to
Victoria,
either
of course,
spend
look like they're
time
starting to
with a
cause some
loved one
alarm.
or to
Yeah,
grieve
so
with their
just
friends
as
and
we
family.
decided to come
And there are
back,
very tight
there seems to have been a
expectations
bit of
around
a
that,
spike
which were
in
designed
Victoria now,
to
which is,
keep the community safe.
not ideal. Of course, we
So-
didn't have that
sorry,
in
we'll
plan,
just
but it
get-
sounds
oh,
like
actually, I was
the
coming back
social
here.
distancing and rules are going to be strict for a little bit longer and maybe get stricter. So, yeah, that wasn't anticipated, obviously. But
Yeah, so I've just
that's not ideal,
spoken with
but
the
we'll
medical
just
officer
deal
of health
with that
about this. So
like everyone
there
else
was,
when we get out.
as I said last week,
see how it goes.
there was a number of
And that was
people
Tom
that came to the
Crampton
house
speaking
to
to us
drop
from
off
quarantine in
and
Melbourne.
understand one of those in the all non-contactless, so all contactless, that one of them spent some time at some distance talking with the women. Now, this can happen, for example, at our managed isolation facilities. People are able to communicate through the fence with others. There's a distance separating people. And the medical officer of health talked about it with the person. There wasn't deemed to be any risk at all, but the person chose to or did self-isolate and was tested. I've just checked with the medical officer of health last Friday and tested.
And then having the kids come out and be able to play for the first time and then see their classrooms.
Yes, there are. And
bearing in mind they've been basically teaching out of porta cabins for the last 8 years.
I think what's extraordinary from my perspective, I mean, everything is just new and exciting
there was
for them.
separation. There was physical distance.
It feels like it's it feels like it was designed by children. There's so many amazing, lovely spaces, like little cubby holes you can go and hide in, and they just feel like it was built with discovery.
I do think that they are adequate, and what we're
some very excited children this morning. Couldn't get here quick enough. So and it definitely didn't disappoint.
Capacity, and also
really magic day. We're just so proud to be back in our community and being able to have over the fence conversations and whānau come into the school instead of their children being bused to Sumner. So a really proud day.
You're right, off the back of the cases in the last week, there has been, I think, a high level of awareness, and people are going for testing, and you'll have seen that the rates of testing have gone up, the numbers of testing.
Information not coming through. Are you giving, is there obstruction on that information about compassionate leave and testing on the ground from officials? What is the hold up with this information a week later with a relatively limited number of cases?
So there's no obstruction. I can be really clear about that. I just want to be able to give you the right numbers, and that we've got a team that does NHI matching, so it can get name and date of birth information, and they're busy matching the results we're getting from the lab database with the people who were in the facilities.
Today I'm joined by Minister Megan Woods, who on Monday last week I designated responsibility for overseeing the managed isolation and quarantine facilities at our border. She updated Cabinet today and is here to respond to any further questions that you may have around the work that she and Air Commodore Darren Webb undertook at our facilities over the weekend. I understand some of you may have questions around our capacity at our quarantine facilities, which the Minister is also available and happy to respond to. Briefly to my week ahead, I am in Wellington tomorrow, but also intend this week to travel to Auckland to meet with officers of the Waitemata Police District. I will travel to Christchurch on Thursday to attend an event at the newly built and opened Te Raukura Redcliffs School to help mark the school's return to its home community for the first time since the 2011 Canterbury earthquake, an event I've been looking forward to. On Friday, I am in Queenstown with Tourism Minister Calvin Davis to help officially open the ski season at Cardrona and to make further announcements as part of our tourism sector recovery plan and work specific to Queenstown. Today, though, I want to update you further on measures to continue to strengthen our border while COVID remains a growing pandemic around the world. And New Zealanders continue to come home as they have the legal right to do.
I know some were.
The World Health Organisation has called the accelerating spread of the virus, with cases now exceeding 8 million, a dangerous new phase. Community transmission persists in other countries, and people are moving more freely around the world than they have in quite some time.
Or there are cases then their circumstances changed, so they left to go back overseas, or they were just going out on day visits. Can I just come here? Now, I understood it had been, and I followed up with the team yesterday, and if it's not on the website, it will be soon, but definitely not holding that back. It's been a really helpful document, just as we've published all the other reviews done by Asia Viral and others on the contact tracing.
With those testing numbers, though, can you see why it does go to the heart of public confidence when we don't know how widespread the problem is, and why weren't a group of Ministry of Health staff thrown at this? We know that you're exceptionally busy, but why not see this as a problem and let's just get it sorted.
Yeah, can I just confirm that they don't present a problem out in the community? We are now working through the balance of these people as an extra precaution. They all spent 14 days in managed isolation. I'm very keen to make sure we follow them all up, and I think the public is keen too, and that's why we're progressing that. We have thrown a lot of resource at this and will continue to.
When will you
You
have
told us
that
about
number?
the 2 women as well, and the 2 women did end up meeting people, and they did turn out to be
Yeah.
COVID positive. So don't
Yes.
55 people represent 55 potential cases of COVID.
The 55 have all been followed, so they have all been followed up. That's the 55 exemptions I'm talking about. So we've worked through from the highest, potentially highest risk, although the risk was extremely low because of the protocols in place, then to the Novotel, then to the broader group. So the 55 have all been followed
So
up.
why then can't you tell us how many of those 55 have been tested and how many haven't?
I just don't have the number here with
Why
me.
not
I'm
just
sorry.
ask them?
So I haven't personally asked them, but
Your
we will.
officials.
Yeah, that's right. Yes.
But have you followed-
Yeah,
you've
I
spoken to
think,
all of them,
again-
the ministry's spoken to all of them.
Yeah.
Why not just ask them if they were tested or not?
Okay. Let me just I'll come back to you on that. I just don't have that with me.
When
Okay,
will
I'm
we
sorry.
get these numbers?
Yep. Sorry.
Do you know when we'll get these numbers?
I am keen to get them as soon as possible, and I want to share them with you when I'm confident in the numbers.
So why do you think that they weren't, because he said all but one have been tested of those 55, is that correct?
Actually, all but one had been followed up yesterday. They had contact had been made by yesterday, and that person was found yesterday afternoon and taken for testing. The 7 that hadn't been tested that I know about, and I wanted to update you on that. Yesterday I said there were 4, that was the children, but there are 3 others who, because of the circumstances, didn't require a test for medical reasons.
They've all been contacted,
Yeah.
and it is important
Yeah.
to know,
Yeah.
going back to what Tova asked,
Yeah.
why not ask them when they're contacted, whether they were tested before they left?
Yes, I
And
agree.
I understand
And
you're trying to,
yep.
The health response is most important and you need to
Sure.
follow and test them, but that number is critical to understanding the depth of failure in the protocols that were meant to be followed.
Yeah, well, what was followed was the requirements around their self-isolation or their visiting protocols. So I will get you that number, and I'm sorry I haven't got it. As I've said, I would like to have it as well. There's a question over here.
The NHI number collected for that 2-month period from April 9 until very recently, was that an oversight?
I don't think it was an oversight. It was just the nature of the information collected, and there's good information on people because they've come through the border. So there is contact information and there is address information, noting that for some people, actually, they hadn't been in New Zealand for quite some time, so may not have had a permanent address, and may not have had an NHI number. But clearly that's something now we will be able to have the NHI number so we can match to other records immediately.
For the new case today that ended up accidentally in quarantine instead of managed isolation, how did that happen? And can you assure us that it hasn't happened the other way, where someone who's supposed to go to quarantine because they were symptomatic ended up in medicine?
Yeah, now I don't know exactly how it happened. I just got that information late morning. But sometimes the jet park facility is used for managed isolation if the other facilities are full anyway. But evidently, I'm told all I have is that there was a mix-up at the airport around the queues. They ended up in the jet park. So that's where they would have been transferred upon diagnosis anyway.
All the people at the Jet Park Hotel, they say it was only when it kind of hit the news media, the fact that those 2 women being released without being tested, that there was suddenly this hustle to test. Is that what happened?
Look, I think there was testing being rolled out that was started with the day 12 people so that we could get as many people as possible before they left managed isolation. Just bringing you back, this is in addition to the 14 days. Yes, it has absolutely sharpened our focus, and I said that last week, and that's why as soon as I found out on the 16th, I asked that no one leave managed isolation unless they've had the test, and the result is negative.
For those 37 days when no cases were identified with links to overseas travel, there were about 7,700 people that arrived in that country, in the country over that time. So to not identify any cases until after the bungle last Tuesday, and then suddenly have nearly a dozen cases in New Zealand, that suggests that you weren't testing enough.
The mainstay, again, since the April the 9th, has been the 14 days managed isolation, which is international practice. We have added in the testing from which we introduced from the 9th. We couldn't test everybody on the 9th, but that is now in place from the 16th. Everybody has around day 3 and around day 12. And I talked earlier in the week about the reasons why we are now seeing the cases. First of all, yes, we are testing. That doesn't mean there was a risk previously. But secondly, the pandemic is accelerating overseas, and we have got people coming back from countries like India and Pakistan, and we've seen the UK and today western seaboard of the US, where they do have a lot of this infection out there. And so hence I think it's helpful we're identifying the cases, because then we can make sure we're really keeping the border safe.
Likewise, number 7,700 were coming from COVID hotspots as well. So are you expecting people to believe that 7,700 people came into the country over 37 days and none of them had COVID-19?
Well, all the ones who developed symptoms, we did identify through testing, and we found 35. There may have been others who were asymptomatic, and that's why they had the 14 days managed isolation, and why we're confident they didn't present a risk to the community, because we did not detect any infection out in the community, and we're now up over 20,000 people who have been through our managed isolation facilities.
Testing rates, you talked about 4,300 today. What's the minimum number we need to do each day to be able to give ourselves effective data to know it hasn't spread?
Well, we know it's not out in the community. However, we have been testing right through, even through alert level 2 and 1, when we were confident there wasn't any community transmission, and will continue to test people with symptoms out in the community. And we've seen an increase in people presenting for testing, partly because we are going into winter, so more people have respiratory symptoms, but also I think the awareness over the last week. Then we will be doing the testing of everybody twice in managed isolation facilities, and we are seeing the number of people in those facilities grow. And we will be doing surveillance testing of people working in those facilities and at the border. So there will be thousands of tests being done every day, and we can do up to 12,000 or just over 12,000 if necessary.
Is there a minimum though you've told your officials we have to get over 2,000 a day or over 3,000 a day?
No, I haven't set a minimum. I know we will get more than that because of the testing in the facilities. But what we want to do is, in a sense, the testing out in the community is like supercharged sentinel testing. In a regular flu season, we do around 270 swabs a week across the country in 90 practices. The first 3 people that come in the door with respiratory symptoms each week get a swab in those 90 practices to see how much influenza is out there and what type of influenza. We're now going to be doing thousands a day, which I would call, just really, really extensive sentinel testing in the community to make sure that if there is any virus out there, we are picking it up.
Do you have enough capacity and funding for all of this testing?
Yes.
Yes. Ever since last Tuesday, when you got the testing working in these facilities and you kicked it into higher gear, you've been finding cases. Was it a mistake not to be testing before the 16th, even and before the 9th, so that, in response to questions like Phil's, you're not kind of guessing, but you would have actually know what the situation looked like?
I don't think it was a mistake, and I think the question's been asked for 2 reasons. First of all, the 14 days is the mainstay and remains the mainstay, as I've said. Secondly, remember that one of the reasons we brought it in was to, because we were moving to alert level 1 with much more travel of people around and interaction with people. So prior to that, under the previous alert levels, there were still constraints on numbers of people and events and so on. So that, coupled with the 14 days, I think provided, and we have evidence that provided us with a high level of assurance that there wasn't infections getting out into the community from managed isolation, because we weren't detecting any out there in the community.
And there was talk about a month and a half ago about a system of sewage surveillance. Has there been any news on that, or are you aware of any work with MOH on that?
ESR has developed the capacity to do this, and in fact they collected samples through the period when we had known infection in the community through March and April, and have been able to detect the virus in sewage samples. So they now have the technology to be able to use that as part of our ongoing surveillance, and that is part of our surveillance plan from here.
Is it being used?
I don't know if it's being used right now, but we'll come back to you on just where they are at, what the intentions are with the next stages in that.
Will you be able to tell us if COVID-19 was in the country earlier than that first identified case?
Yes, it could. It could, of course, Where this has been used elsewhere, there are much higher rates of infection, but what they have shown is we're able to detect the virus when we had those, even then, still low rates of infection in the community. And then there will be ongoing testing as part of our surveillance to just see if there is any in wastewater. So that will be part of the overall surveillance.
Do you think that there's a kind of weak link in our protocols in terms of the lack of enforced self-isolation for flight attendants coming back into the country?
Yeah, that's something we're looking at very tightly. The area we were most concerned about was the western seaboard of the USA, just because of the arrangements there. So we've worked with Air New Zealand to introduce that in all those aircrew have to stand down for 48 hours and be tested and return a negative test. We've been talking actively with them over the last 48 hours around Australia, because what's clear is that people are coming from high-risk areas converging in Australia in transit and then coming across. And we've had several cases now on those flights. The protocols used on those flights by the staff are the same as on any international flight. So I'm confident about that, but we're looking at what else we may need to add, and active discussion, and expecting to confirm some further arrangements with them. One which is already getting underway is the provision of masks to all passengers on those flights.
And that could look like an enforced managed self-isolation period of 14 days for fuel crews?
No, I don't think it will look like that, but it could look like, and one of the measures could be to make sure that those crew are solely on international routes, not also flying domestic routes, because they're the same A320s are used. It could look like similar to what we're doing with the LA staff, but we'll work with them on that. The main thing here is we're trying to reduce the risk to the crew and, of course, to the wider community.
Are you looking to bring those masks, sorry to clarify, passengers on flights, those masks, are you looking to make that mandatory?
What we're looking to do is, and the advice is that that's strongly recommended, and so I talked to the CEO of Air New Zealand on Friday. The minister's been talking to Air New Zealand again today, and the intention is that masks will be handed out to all passengers once they're on the flight, and they'll be shown how to wear them. So there may be the odd person who can't wear one for a medical reason, but I think people will understand that that's part of the protocol and use them.
Do you consider our isolation, the strict isolation, that it's strict enough? Like in Australia, for example, if you're in isolation 14 days, you're only allowed 15 minutes outside of your room every week. Should ours be tighter?
Well, we're looking at that. It appears to have served us well to date, but of course we're looking at whether we might strengthen it. For example, at least for that first period until people have returned that initial test as negative. But we're looking at all these things. We're really, really focused on making sure it's working as it should. Perhaps the last couple of questions.
Currently they're allowed to leave every day for some fresh air, is that correct?
That's my understanding, yes. They can go outside and into the area outside the facility and do some exercise, but not out onto the streets.
Can I just rephrase an earlier question? That you say you tried to find that number on the patient grounds who haven't been tested, and you want to know that.
Yeah.
Do you find the fact that you haven't been told, we don't know, do you think that is acceptable?
Look,
and if not, what needs to change? Should
yeah,
it just be like a simple database?
Yeah, I agree, and it's what I've got people working on at the moment on, including with the all of government team. So we've got a single database that covers end to end, including the health aspects of that managed isolation process, as well as the non-health aspects. Yes, I think we need to get that in place, and I know there's a team working on that. I would really like to have that data and to be able to provide you with the same certainty every day as right from the start of being able to provide the case numbers and the cluster numbers and all those sorts of things. So we're wanting to nail that very quickly. I can't say. I'm sorry, but I will find that out. Okay.
Hi, is the Ministry of Health advising Air New Zealand on any, I guess, lifestyle options for flight attendants that come back? Like, are you advising them maybe not to go home the weekend after they return from an international flight?
Not at the moment, but all these things are obviously in discussion. The key thing is, and this has again served us well right from the start of the outbreak. You'll remember early on, in fact, the protocols being used by flight staff now are the same as the ones we developed and agreed for that very first evacuation flight out of Wuhan. So the same use of masks and/or gloves and/or hand sanitizer and infection prevention control cleaning procedures are now the same on any international flight as they were with that original Wuhan flight.
So as it stands right now, I could, if I was a flight attendant, I could fly from the US back to go on a, like pick up someone from Australia who'd been in the US, fly back to New Zealand on Friday, and then go out clubbing with my friends on Saturday.
Yes, potentially. However, again, with the caveat that there are very clear protocols in place, because of course Air New Zealand want to protect their crew as well. And so those protocols, which have been in place since that February evacuation flight, are the ones that are still being used now. On a question?
Has the thought towards using these rapid point-of-care tests either on that day one at the border or in other scenarios? Yes,
definitely watching that. And I just read last week a study done in Australia about the point-of-care testing, and also there's the serology testing as well. Just still not reliable enough. And whilst it could play a part in the overall sort of checking people, both at exit and entry, but we don't think it's reliable enough now. I should say the other thing we're doing is looking at the protocols and processes in place where people are getting our boarding flights at different ports to make sure we've got a high level of confidence that there's appropriate symptom checking and or temperature checking before people get on flights to New Zealand.
Do you think it's good enough that you don't have, that people, you should have these figures to hand, the testing figures, that you don't have them? Is it your officials let you down?
No, they haven't let me down. As I said, I would like to have those numbers. What I can say, and what we're absolutely focused on, and that's why I'm here today, is we have worked systematically through where there may have been any risk and spread the net very wide to make sure we contact, first of all, the managed isolation exemptions, compassion exemptions, then anyone who was in the facility or associated with it, that's the Novotel. And then we've gone even wider just to be sure. But this is an extra precautionary measure, remembering that the latter group, everyone had done the 14 days managed isolation. I'm as keen as anybody to ensure that New Zealanders are kept safe and that they feel safe. And part of that will be ensuring that we can assure them about the numbers. So we will get them as soon as possible.
Do you accept that undermines confidence in yourself and the ministry?
I think what would undermine confidence is if I wasn't fronting, if I wasn't saying I'm responsible for sorting it out, and that we weren't following up these people and doing everything we can to make sure New Zealanders are kept safe. That's clearly what we are doing, and I'll stand by that. Thank you.
Thank you.